Back on Inside Tennessee with the Dean of the Senate, Lieutenant Governor Randy McNally of Oak Ridge. And I want to shift the conversation to mental health. It's my understanding, Lieutenant Governor, that Tennessee hasn't raised reimbursement rates for mental health services in about a decade, but there's a move to change that this year. Is that something you would support? And if so, why is it important?
Well, I think we did raise the reimbursement rates in the mental health systems, and then there was some money that we were able to, I believe, and it was one-time federal funds that we were able to give the regional mental health and state mental health institutions. I would, of course, support increasing the funding. It's hard to get good staff when other institutions that they could go to, i.e. hospitals or veterans' homes, are paying higher rates. But also I think we need to look at and I know Senator Burchett has been a big proponent of this, and I'm hopeful we're able to do something this year as far as a pilot program that looks at maybe diverting a lot of the prison population that is really mentally ill, and their crimes are not violent crimes, they're simply misdemeanors that they commit, diverting that population to mental health facilities and halfway houses, and eventually getting them a job where they can work. I think that's been real important to me, and it's really come to my attention a lot closer to home probably the last couple of years.
Representative Smith?
And on that one, we'll just stay with mental health for a second, because this is an area where I've become extremely passionate about. You know, one of the things that we've seen through COVID is the rise of mental health issues, especially affecting our children. I believe it was the children's hospitals across America have declared it an epidemic that's hitting our kids right now. So what do you see putting into the budget, especially as it relates to mental health funding for children, especially children that have been through abuse and neglect?
Well, we have some great children's hospital facilities. Children's Hospital in Knoxville, of course, is one. And being able to increase the staff there that is our nurses trained in psychiatric training, the advanced practice nurses in that field, and paying for them in the children's hospitals is one thing that I think we'll be looking at. The other thing, and I hope we can accomplish it, the other thing is the CACs, the Child Advocacy Centers. A lot of those children have been physically abused, but a lot have been mentally abused. And we hope to be able to increase the funding for those centers.
Don?
Well, and you know, one of the things that we've seen also through the children's hospitals, children are waiting sometimes days upon days just in the hallways. So that is one area where I would highly recommend that you go back and encourage your colleagues just to really look at mental health funding, because children sitting in a hallway versus getting immediate help is something that is desperately needed, not just in Knox County, but it's happening all over the country, unfortunately.
Don, go ahead.
Argument for accepting affordable care dollars from the federal government right now. So thank you, Eddie. But let's, again, staying on mental health, Lieutenant Governor, I'm now beginning my 34th year as a criminal defense lawyer in this community. And I think my entire career, I've heard politicians say, we really want to do more for mental health. And it seems like every year it just gets a little bit worse. And I remember the closure of Lakeshore. I remember certain programs that we've had just here in Knox County within our local jail system with different ways to divert. and it just seems to be getting no better, and one might argue worse. What are we really going to do differently now at a legislative level to improve mental health care?
Well, I think if you looked at where mental health care was some years back, for example, when I first came to the legislature in the early '80s, you'll see a vast improvement in what we're doing, but there's still a lot more that we can do. There's a lot more in the areas of both treatment and particularly aftercare. When somebody has a mental health episode and goes into one of the regional facilities or one of the state facilities, being able to put them in a halfway house and then follow them and make sure that they are taking their medicines and that they are, if they do have a relapse, make sure that they are treated quickly and helped quickly.
One last crystal ball question, Lieutenant Governor. We typically see about 3,000 bills filed in a session and maybe 10%, 300 or so passed. But everybody is always worried about when the legislature will be out of session. When do you think that'll be this year?
Well, they usually in the fall start asking us when we're going into session, and as soon as we go in, they start asking us when we're going to leave. But I think it'll probably be maybe the first week in May, and that's simply a guess. A lot could depend on what happens with COVID or if there's another epidemic. A lot of things could impact that.
Fair enough. Lieutenant Governor Randy McNally, we always appreciate the time. Thank you very much, and best of luck this session. We'll check back in with you.
Thank you, Don and Eddie.
We'll be back with our talk around right after this.